what is the main kind of criticism or pushback when people bring up the subject of parasites? Like and why is this not
lack of knowledge?
Okay.
Just lack of knowledge, lack of education, not understanding it.
And is that because like, how do you even know if you have a parasite? How do people figure this out?
Well, symptoms usually are pretty clear indicators, like the whites of your eyes are turning red consistently, the sclera, your brittle hair, dry skin, very uncomfortable. You can't gain weight or you can't lose weight. Diarrhea constantly, constipation, irregular heartbeat, muscle twitching, patchy, dry skin. I think I mentioned that. Not sleeping properly, constantly in a state of stress, constantly in a state of confusion, mood swings, depression. All of these things could be involved in a co-infection.
So everybody has a parasite.
Everybody has parasites. No, everyone has parasites. If you're living in a glass ball, maybe you're not, but you might have passed on from your mom. So your mothers can pass on parasites. That's why that's why you got to be very careful if you're pregnant. You don't want to be around cats that are outside and stuff like that. That's a really big deal. Toxoplasmosis for a mother who's about to carry a baby and for that child is very dangerous. That's a dangerous thing.
So, okay.
So those are symptoms.
Sure.
You can also do a stool test. You can also do some blood work. They can also take a look at your immune system markers and test like tumor necrosis factor, IL-1, interleukin-1, all these different inflammation markers. If they're triggered, then it's possible that you have co-infections in your body. Throw in Epstein-Barr, which is a form of herpes, and all these viral loads, HPV, all these things, they all meet together and create loads in the body that create confusion and all of the symptoms that I just brought up.
So let me try to make some people feel better here. So because everyone's listening to this right now and being like, holy shit, I probably have parasite. I'm freaking out. What the fuck do I do? Right? Like that's the first question people are asking themselves.
Well, don't get scared. Just get aware and bring the knowledge in and have some strategies.
So where are people picking up these parasites most commonly?
At the airport, through their friends, sharing food with people, kissing people, barefoot on the earth, which is crazy because I'm a barefoot guy, right? Sitting on a bathroom stall on the toilet.
Walking in my house after you've walked through the park and petroleum at the gas station in your cowboy boots.
I don't do that anymore.
No
Towns
shoes in the
is
house.
then crawling on my floor that you think...
Please, don't use this as your personal therapy session.
But
please,
I can't.
Please.
No shoes in my house, Parasite.
Okay, so... here we go. Okay, so these are the places that people are picking them up. And
sushi.
Most people are their systems... Oh, not to say most people. People with strong immune systems, strong function, healthy people that are taking care of themselves, are their systems able to eradicate these easier?
Yes.
Is that the main thing? Okay.
Absolutely.
So people that are not, having oversight over their body, not taking care of themselves, maybe eating like shit, putting poor things in their body, all of the things that we know we shouldn't be doing, it's creating an environment for these things to get stronger and live longer in their system. Is that correct?
Bingo. To wreak more havoc when your ability to resist pathogens and all these other toxic loads starts to weaken, then those things start to proliferate and those things start to create, they burrow themselves into cysts in the body, and other people call them biofilms. These things are embedded within us. If you have an immune system that's dragged all over the place, then you're in war in every different angle. That's the whole thing. That's like, think of a military, right? If you have an enemy on the other side of the line and you know where that line is, you want to bottleneck them in one section, right? Because that's where you're going to have your guns. That's where you're going to have your firepower. But if they get around you in a circle and start digging into all these different fronts, that's how if you look at history, that's how they lose the war, right? Is they have all these different openings, right? That's how the immune system works. And co-infections work like that. So you don't want to have the line of your immune system have holes everywhere. And that's the key of having a strong microbiome, having strong hydrochloric acid in your gut, having a strong immune system, starting in your oral health. It's interesting, like you can get cavitation surgery and they can find parasites that are burrowed into your holes of your mouth.
What do these things look like? When I think of a parasite, I'm thinking of like a worm that's running around. Is that what
they all look different? They're microscopic.
Different.
Some are big. Some are tapeworms, or it could be a couple feet, if not longer. Some are microscopic, gram negative, meaning like really, really small and different. The walls of the cells look different. Some have sharp edges, like spirochetes that come from ticks for Lyme. Those things they look like little screws. They come in all different shapes and sizes. It's full on, it's a whole nother realm out there that's burrowed within us. And again, look, I'm not trying to scare people. This isn't a fear thing. This is just being aware. I come across too many people that are struggling with this kind of stuff. And so we just got to shine the light on it and put some knowledge there so we know how to live a healthy lifestyle and find balance and thrive, as opposed to always being in a deficit and always being under the gun. And that's what these things do. Co-infections take you into a deficit. That's why, you catch a cold 3-4 times a year. My whole thing is, and what we're learning is, you're catching a cold because your immune system's down, right? You're not supposed to be getting strep throat all the time. You're not supposed to be coughing up phlegm all the time. You're not supposed to be sick all the time. You add that up for 40, 50 years, that's like 2-3 years of your life, you're sick. And there are studies, like someone who's got, chronic strep throat, which is linked to bacterial infections and things like that, they start to have a higher chance of throat cancer, right? These things they connect, all of them connect. So we want to mitigate the damage from this point on, and we want to lower the burden in the body.